everyone. I have a very special guest with us today on the Embracing Joy podcast, where we speak with high achieving professionals to help them learn how they can embrace more joy in their lives, both personal and professional lives. I'm so excited about our guest today. She is Dr. Sadaf Lodhi. I would tell you more about her. She's a wonderful, experienced OBGYN, and she has over 20 years of experience. She currently runs a concierge medical practice in New York, and she also has a telehealth practice for her Michigan patients. Her focus spans all aspects of female health, with a special emphasis on sexual health, menopause, and intimacy coaching. She's board certified and she holds additional certification as an executive coach from Rutgers University. She graduated with honors in biochemistry from the University of Michigan, Dearborn, and she earned her doctorate in osteopathic medicine from Michigan State University. She also completed her residency in gynecology and obstetrics in Michigan, and she is also a Menopause Society certified practitioner and an ISSWSH fellow. So all things women's health, sexual health, intimacy, Dr. Sadaf is the expert. So I'm so excited to have her here to discuss this topic, which is embracing joy in sexual health with expert Dr. Sadaf. So thank you so much for joining us, Dr. Sadaf. Would you like to say hello or add anything to the introduction? I know you also have a wonderful podcast called the Muslim Sex Podcast, where she talks and delves more into sexual health and intimacy topics as well. Yes, so I know you've done amazing things. So if you would like to add anything else as far as the introduction, please go ahead and share with our audience.
Well, first and foremost, thank you so much, Magda, for having me on. I really appreciate it. And I appreciate your time and your listeners' time. So yes, I am board certified OBGYN, Menopause Society certified practitioner, and an ISHWISH fellow, which basically just means that I focus on sexual health. And of course, said that I have my own podcast, the Muslim Sex Podcast, and I also have done a TEDx talk, which is called Sex Education for Doctors, Lessons from a Muslim Gynecologist. So I did that talk last year in November, and I'm hosting a retreat coming up in Morocco.
Oh, wonderful. Oh, that's going to be fantastic. So tell me more about, so the retreat is going to be a sexual coaching or intimacy coaching retreat, or what's the focus of your retreat?
Yeah, actually, so I am co-hosting this retreat with a friend of mine, another gynecologist. She focuses on nutrition. She was a dietitian before she became a gynecologist. And my portion of it, I'll be focusing on sexual health, perimenopause, and menopause. And it will be held in Morocco. And September 16th through the 23rd of this year. And we're super excited for it. We only have a couple of spots left, but it's going to be amazing. There's going to be like daily yoga, meditation, hammams, all that great stuff. But yes, the focus is menopause, perimenopause, sexual health, and nutrition.
Oh, that's wonderful. I would love to go. But unfortunately, I'm not able to go. But listeners, if you heard that, then you want to be on the list to go. There's not many spots left, so try to get in there. Dr. Sadaf is an expert in her field, and just being in that setting of beautiful Morocco, learning about nutrition where the food is organic and wonderful and so delicious, you will definitely enjoy yourself. So we start most of our podcasts with a game, which is called Convergence.
All right.
So we will start with the game. We'll talk about, just tell me the first word on your mind when we count to three. So we'll count to three, or 3, 2, 1. And you just say the first word that you can think of. You ready?
Okay, yeah, let's go.
Keep your eyes open, close, whatever you think. So 3, 2, 1. Peace.
Menopause.
Peace and menopause. So something that connects peace and menopause. Okay, I got something. Might be specific, but we'll try. Ready?
Yeah.
3, 2, 1. Estrogen.
Women.
Okay, estrogen and women. Yeah. Let's see. So we try to say it at the same time so that you don't hear my word before you say it.
Okay, got it.
Okay. That's okay.
I'm like, I don't know.
That's fine, but so there's a little delay because of the Zoom sometimes, but we try not to hear my word before you say your word because we
Ah,
want it.
got it. Okay. Okay.
So
Got it.
estrogen and women. Okay, something that connects those two. You ready?
Mhm. Mhm.
3, 2, 1. Hormones.
Hormones.
Hormones. Yeah, yeah,
You
hormones.
got it. You got
We
it.
got it. Yeah, so we're on the same page. We're on the women estrogen hormone page. Yeah, our brains have converged. Okay. All right. So you do such fascinating work with women and women's health. And I know that with your experience as an OBGYN, you've kind of seen the importance of sexual health.
Yeah.
With your expertise in sexual health, we know that sexual health is important,
Mhm.
but it can be something that as professionals, especially when they're high achieving or really focused on their career, that they may neglect to a certain extent. Do you see that in your practice? And how do you feel like once people or women are able to really adapt and learn more about their sexual health, do you see a change in their overall well-being and their overall happiness in life?
Yeah,
Mhm,
that's a great question. So I think what happens is that, for women that are high achieving and very busy, I think what happens is that oftentimes we neglect our own health and our own needs. And I think that that happens not only when it comes to our work, but also when it comes to household responsibilities and children and all of that. What I do is that when I work with women specifically, I think this is a question more about kind of like coaching, right? And
mhm,
so I can give you a case example. So I had a patient, a client rather, that is a physician,
mhm,
and she told me that she just was not able to get on the same page as her spouse regarding sex and
mhm,
intimacy. And basically, he's a dentist, she's a internal medicine, and they just couldn't find the time to kind of get together because they're both very, very busy. And so what I suggested to her was to find some time during the day, whether if it was like, I wanted at least 15 minutes where she was not distracted, where she was not, thinking about anything except her spouse and
mhm,
he doing the same. And whether that was, early morning or if it was late at night, whatever, not when they're too exhausted, because I think when you're too exhausted, all you want to do is sleep. You don't want to sit there and
mhm,
talk, right? So it
mhm,
has to be a time, before bedtime that you're sitting there talking and that you create that time, right? You put it into your phone and you find that time that you can speak to your partners about whatever it is that you want, your desires, your wants, your fantasy, whatever they are, right? But
mhm,
the point is to create the time and put it in your calendar. And I think that's the most important thing that you can do. So I suggested this to her. And this was something that I know it sounds super easy, but it was something
mhm,
that she never thought of is to
mhm,
actually create that time in her day where she would just focus on her partner. So, the phones were put away. They were, the kids were done. She was done with dinner, whatever, blah, blah. And now it was just their time together. And
mhm,
then she was able to focus in on him. And the interesting thing is that, she realized that after their talks together, that he always preferred intimacy in the morning and she
mhm,
preferred it, having intercourse at night. And what they decided then, because there was kind of like a mishmash of, and that's why they weren't able to get together, because they were both on different ends of the day, what they decided they would
mhm,
take turns and alternate. And this all came about just by having a conversation, right? So I think even making that time just to communicate with your partner results in
mhm,
finding solutions to problems that you think there may not be solutions to, right? When she first started talking to me, she said, "Oh, it's so frustrating. He's always tired at night. He just goes straight to bed or he wants to watch TV. And I'd rather, be intimate during that time." And in the morning, she goes, "I'm rushing off to work." And that's when he thinks that he would like to be intimate. So, I don't think that there's a solution. And then when she started to have those discussions, right? Because I think also what happens is that not only do we not make time for each other, but we don't have these conversations that we often find are difficult to have
mhm,
because we're afraid that maybe we might offend that other person or maybe they might take it the wrong way. So we don't have those very important conversations. So when she made the time to have those important conversations, then she was able to find a solution to the problem that she saw that she wasn't able to come to a solution.
hmm. Yeah, so how did that improve her overall well-being? Did you see, like, a lot of improvement in
Yeah,
her overall?
absolutely.
Sure. Mhm. Yeah.
So she was able to definitely what they noted in their relationship is
Mhm.
that they were able to create that emotional intimacy that they were lacking in their relationship,
Mhm.
and
Mhm.
that bonding and being able to be vulnerable with each other by just having that communication definitely increased the joy because she was able to find that emotional connection, emotional intimacy with her partner, right? So that was the way that she increased her joy and her connection with her spouse.
Mhm.
And they continued those conversations. They were able to what they did is they extended the times that they were talking to each other. So maybe they started out initially 15 minutes and then they increased it to 20 minutes and they were able to find that time for each other. And so I think oftentimes what we see, and
Mhm.
even in research, what we've noticed is that the biggest factor in whether or not a woman is sexually satisfied is communication, whether or not she's able to communicate with her partner.
Mhm.
So knowing that and creating that time and that space to be able to communicate with the partner related to her having more, sexually satisfying encounters or also just being satisfied in general with her relationship, right? She didn't feel like she and her partner were just roommates, but instead
Mhm.
they were, two people that understood each other and knew what each other's wants and desires were. And then they were creating that time and space for each other. I think also something that I find for individuals that perhaps are not able to see each other or create that time is to have date nights. And that actually works for people with different libidos. So, for example, let me just explain this. Somebody that has a high libido,
Mhm.
may always want to have sex or be intimate with their partner all the time. Somebody with a low libido may not want to have intercourse or sex at all or very
Mhm.
little, right? So, how do these two come together without creating resentment and anger toward each other? Right, because the person with the low libido may always be, turning her partner away, and maybe somebody with a high libido may always be coming on to their partner, and their partner may just get frustrated,
Mhm.
and that could be making matters worse. So, for those individuals, what I suggest is to have a date night. The reason why date nights work is because the person with the high libido knows that this night, whatever day it is or night, whatever, their partner is going to be making time for them. And that night, that partner is going to be ready because they'll have time to have thought about it. And
Mhm.
so mentally, they can prepare for, being intimate with their partner. And so the person with the high libido knows that that night they'll have some personal time, right? Maybe some physical intimacy with their partner. The person with the low libido, by creating that date night, they can kind of wrap their head around that time, that space, what they're going to do, what they're going to wear, how they're going to prepare for it. And so that they already know that if they are, and of course, this has to do with communication again, but that person with the low libido knows that if they give their partner a hug or a kiss or show some type of affection, that person with the high libido isn't going to automatically assume that it's going to lead to some physical intimacy, right? That they can
Mhm.
just go ahead and show affection without it having to result in anything else. So the way that those two come together is that they have a day where they both know that they'll be physically intimate. So maybe one can prepare for it and the other will no longer have that anger or resentment of constantly being turned away.
Mhm. Mhm. No, I think that's a great idea, and I'm sure you've seen it a lot in practice of,
Yeah.
working with so many couples over after many years that you've been practicing as an OBGYN and also as a coach. So thank you for those tips. I'm sure a lot of people listening can incorporate those tips because they're pretty simple to do,
Yes.
right? Just adding time, that 15 minutes into the schedule or incorporating a date night if you have a difference in libidos. Yeah, those are a great start. And of course, if they need more, they can contact you or someone for more coaching to
Right.
look more into that. Or if there's an underlying medical condition that may cause sexual health issues, you could help with that as well. So, and I think that could be part of it too. Is it's some couples may have an underlying medical issue where there's pain with sex or an issue that can cause the low libido, and of course, that's the time when they should see a OBGYN, correct?
Right,
Yeah.
absolutely. And so anytime, say a patient comes to me and they're talking about libido, for example, let's
Mhm.
just take that as an example.
Mhm.
Libido is it's not an easy fix, right? So
Mhm.
we're just giving an example of a high libido, low libido, but
Mhm.
definitely when you talk about libido, when somebody comes to me and talks about libido, it is like a 2 hour long conversation, because there is, in sexual medicine, we always deal with the biopsychosocial model. Bio meaning like anything anatomical that could be resulting in low libido. Maybe there's issues with lubrication. Maybe there's, pain with sex. Maybe they have vaginismus. Maybe their vaginal muscles are tight. Maybe they have, some anatomical thing going on. Maybe there's some strictures in the vagina, whatever it is, right? There could be lots of things going on. Also, biological things could be medications that could be affecting their libido. We know that birth control pills can affect libido by decreasing it. We know that antidepressants can affect libido. We know that some antidepressants can affect orgasm. So, when we talk about the bio part of the biopsychosocial, we're talking about that. Then the psycho part of it is a psychological component, right? Is there anxiety? Is there depression? Are those meds causing issues with libido? And so we have to address those. Then the social aspect of it, right, comes in where we're looking at, are they a single mom that are working like 5 jobs, and, physical intimacy is just another chore that they have to do at the end of the day, right? And anything that becomes a chore, they're not going to want. So, it's just going to be another thing that they have to get done. We also know that uneven distribution of household chores, research on that. And we know that that can also impact desire, right? So when you have so many things on your plate, you're not going to want intimacy. Also, do they come from a conservative background where they were taught that sex is wrong, it's dirty, it's shameful, and that there's guilt associated with it. So they come with a lot of the sex negativity, and that's affecting their libido, right? So you can't just give somebody a pill. There are pills, by the way. There are 2 pills that are FDA approved for libido. And there is one off label that we use, which is testosterone, which is indicated. There was a FDA, there was an international consensus regarding testosterone to come up with the International Society for the Study of Women's Sexual Health, also the Endocrine Society and the American College of OBGYNs. They basically all came together and created this international consensus on testosterone, and stating how to use it, how to check those levels, how to see whether or not a patient is, therapeutic on testosterone, to see whether or not it is affecting their libido. So, all of those things are really, really important to assess when it comes to assessing something like libido. So when a patient goes to a doctor, for example, and they only have 15 minutes to talk about
Right.
something like this, there's no way that doctor can assess them, because this is a long conversation. It's not something that I can just be like, here's a pill, you're going to be just fine. No, because we have to go into all those other aspects.
Yeah, and I find that, I'm a, family medicine physician, and our training is not that extensive, especially when it comes to sexual health or asking about libido. And if we did ask about libido, for most physicians, just in our general primary care education, it's not in so much detail as you have had, as far as getting that additional certification and specialization in sexual health, right?
Right.
So
Exactly.
there, I'm not sure how many physicians are as well versed in, taking, and even if they are well versed, that have the time to take that time to delve into the reasons,
Exactly.
right?
Yeah,
Right.
definitely.
Mhm.
Definitely, that's a problem that we have. So I think that, unfortunately, throughout history, right, women's health has not received really much attention, and there hasn't been much research devoted to women's health, and specifically even sexual health. So I think that we have this huge void, and most of the research, especially when it comes to sexual health, has been done on men. We've had Viagra for how many years now? Forever,
Mhm.
right? But only in 2015 was there an FDA approved pill for women. So that just goes to show you how less interest there is in women's sexual health and sexual function. In fact, when we learned about sexual health, really just sex, we learned about the sexual response cycle. And I'm not sure
Mhm.
about you, but when I learned about it in med school, when I was going to med school, all we learned about was the Masters and Johnson model, right? And how many hours were devoted to sexual health. Well, in my med school, there were probably only like, I don't know, maybe like 2, 3 hours. And that was really just the physiologic aspect of sex, but not really much else. And then in residency, you would think that as an OBGYN, That would be one of my core, rotations or components, and it
Mhm.
wasn't. I mean, I didn't learn anything about sexual health, and that's part of my TED Talk as well, is that really, we're doing our medical students a disservice because we are not teaching them about sexual health. We're not teaching them how to even get a sexual history, and so then when they become residents, when they become attendings, how do they answer the questions that their patients come to them with, right? We don't have those answers. And
Yeah,
unless you get additional training or education, most physicians do not feel comfortable answering questions about sex.
you're right. You're right. So I'm glad that you did that TED Talk to raise more awareness about this issue, especially for physicians and clinicians, because patients, even physicians ourselves, we're patients as well, right? So
Absolutely,
we need
absolutely.
to know where to go and who we can talk to about these same issues.
Right,
And of course, it would be ideal for most physicians to get additional knowledge and education on this, or medical students up and coming, so that they can at least have more knowledge and
right.
education on this. Or we could do it as continuing medical education on this as well, as part of our requirements within our continuing medical education. So
Absolutely.
thank you so much. This has been a great topic. You've shared so much information and wisdom as far as sexual health and intimacy. Can you talk a little bit about, as just coming to me, is the relationship between joy and sexual pleasure? Because I feel like sexual pleasure and joy kind of go hand in hand. You have to give yourself permission at some point to have both and to receive both of those. If you can kind of describe, or what you think would is the relationship between sexual health and sexual pleasure and joy.
Oh my gosh, I think that's a fantastic question because, it's so funny. I am hoping to write, and hopefully I will find some time in my free time to write a book. And it's going to be called Give Yourself Permission for Pleasure.
Mhm.
And
Mhm.
so it's funny that you should say that. So, exactly. I think what happens is that, and specifically, and, this again, I feel like this question is more with coaching, is that when we are, let's just say you're raised in a very conservative environment, right? And sex is wrong, it's dirty, it's shameful, and that's just kind of what you grow up with. And
Mhm.
so you grow up with the sex negativity, right? I feel that it's hard to go from sex negativity to sex positivity, right? That's like a whole 180-degree shift that you have to make. I feel that if you can go to at least being sex neutral, then just being sex neutral, you are allowing yourself, you're giving yourself permission to experience pleasure. And then when you give yourself permission, then you're going to be receptive to sexual stimuli or some type of advancement or some type of invitation from your partner, right? But if
Mhm.
you don't give yourself permission, then you're never going to be receptive to it because you're always going to feel that there's something wrong, that you're going to have this guilt. I will kind of go through a little bit of what I do with my sex coaching. Oftentimes what we do is we start with our thoughts because we know, and you and I are part of a coaching program, which I think is fantastic, but
Mhm.
we always know that it's our thoughts that lead to everything, right? And that's with cognitive
Mhm.
behavioral therapy, is that we know that our thoughts lead to our feelings, which then lead to our actions. So if we're thinking that sex is wrong, it's dirty, it's shameful,
Mhm.
it's guilty, then the feelings I'm going to have are those fear and maybe of even disgust, right?
Mhm.
And so if I have those feelings, then the actions are going to be that I'm never really going to be receptive to sexual stimuli or any type of sexual advancement from my partner. And so actually I know somebody that she and her partner, husband rather,
Mhm.
have never been able to consummate their wedding because
Mhm.
she has severe vaginismus. And we know that vaginismus, for your listeners that may not know what that is basically the muscles surrounding the vagina become tight. And so they're really tight. And so it becomes hard for this person to have any type of penetration because it's as if her partner is hitting a wall. Right. Every time they try to have intercourse because those muscles are so tight that they can't relax. And what happens is that not only is it an anatomical issue, but it's a cognitive issue because
Mhm.
that person is anticipating pain. They have this fear that it's going to be painful. And, sometimes it becomes so ingrained that they can't even control it, that it just happens with them, even if they want to have, penile vaginal intercourse, they're not able to because their brain automatically anticipates something awful is going to happen, right?
Mhm.
So what they have to do is not only do they have to, in this scenario, this person would have to, for somebody that has vaginismus, they'd have to first go see their gynecologist, make sure there was no anatomical issues going on or anything, in that regard, preventing them from having intercourse. Then that gynecologist would do a pelvic floor exam, right? They would check the muscles in the pelvis, which
Mhm.
they do a vaginal exam, and then they check those muscles surrounding the vagina, and they would realize that those muscles, they would touch on them and they'd be very tender and painful to the individual. So they would
Mhm.
see that this patient has this vaginismus. Then what that doctor would do is recommend a pelvic floor physical therapist. And the physical therapist would help to, one, show them exercises to relax those muscles, but also, the doctor may need to inject with Botox depending on how tight those muscles are to help relax them. But then
Mhm.
the pelvic floor therapist may also give them some vaginal dilators to use to help relax those muscles and get them used to, having something inside. That's just the anatomical portion of it, right? Then you have to get to the cognitive part of it, where you have to work on the mind. So even if the anatomical portion of the body, is working out okay and is starting to get used to something inside, blah, blah, you still have to work on those thoughts. And
Mhm.
that's where a sex therapist comes in, or a sex coach comes in and really has to work on those thoughts, that fear that automatically then causes those muscles to tighten up, right? So you have to
Mhm.
really work on, how am I going to be able to change these thoughts from, say, like fear to one of, being okay, one of being neutral, to one of being receptive to having some type of insertion. So yeah, I mean, there's like a whole, process to this. And I
Mhm.
think that that's why it's so important to work with somebody that really understands not only the anatomy, but also the emotions that go with, sexual health issues, sexual dysfunction, so that you can get a more holistic approach to the medical issue.
Wow. Well, thank you so much for explaining, especially in that specific case, Yeah, so and I love that you described going from like a thoughts of disgust or thoughts of shame to at least a neutral position. But there is help for that. So it's not something that someone has to do alone. They can reach out
Yeah.
to an intimacy coach or someone that's well versed in this to help them move along that spectrum so that they
Right.
can give themselves permission to enjoy sexual pleasure, to enjoy their life and have that joy as far as with their sexual health. We are wrapping up. So we had a great interview. I learned a lot talking to you, Dr. Sadaf. I know our listeners learned a lot at our wrap up questions. So we'll go over our wrap up questions. Dr. Sadaf, who is a model for joy in your life and why?
Mm, that's a
Could
great
be
question.
anyone that you know, or it could be
Yeah.
someone that you don't know, or,
Yeah.
anyone. Mhm.
I would have to say my sister. So I
Mhm.
have an older sister, and she's experienced some difficulties in her life, but every time you see her, she's always smiling, like
Mhm.
always smiling. She's always laughing. She's always finding the joy in everything. And sometimes I just look at her and I'm just completely amazed. I'm like, this is really amazing. Like the fact that she's so happy and jovial, even though that she's experienced some hardships and things like that, but yet she finds the joy in everything. She finds just the positive aspect in
Mhm.
any situation that she's having and experiencing, and really is enjoying her time with her friends and her family, and just laughing and really just enjoying life, which I really respect. So I think I would have to say my older sister.
That's great. So, if you were baking a cake of joy, not necessarily a real cake, but a cake of joy, what would be your top three ingredients?
Cake of joy.
Mhm.
I would say, gosh, there's so many things I could put in there. I would love to. A cake of joy would be happiness, right? Safety,
Mhm.
peace, freedom. I would say those are 4.
Four.
But
That's
those
yeah,
are
those are good. Yeah,
Yeah,
you need happiness, safety, peace, and freedom is, yeah, very important to have joy as well.
yeah,
But
yeah.
great. Okay. Well, that was our interview. If you would like to learn more about Dr. Sadaf or work with Dr. Sadaf, please check out her Muslim Sex podcast. You can find it on, I've seen it on Spotify, but I'm sure you
Yeah,
can also
yeah.
find it on Apple,
Yep, Apple,
as well
Spotify, YouTube.
YouTube as well. She's also on TikTok and Instagram. So on TikTok, she's at Dr. Sadaf OBGYN. On YouTube, she's at Dr. Sadaf Intimacy Coach. And you can also find her on Facebook, Dr. Sadaf Intimacy Coach, and her email as well. If you would like to email her, it's drsadaf at drsadaf.com. If you would like to learn more, this was a wonderful episode. Please share with someone in your life that you think this will be helpful for, especially as it pertains to embracing joy with sexual health and sexual well being. So, thank you so much, Dr. Sadaf. It's a pleasure having to you. You could add whatever you would like to say to our audience to say your final greetings.
Yeah, well, thank you so much for having me on, Dr. Magda Majette, and I really appreciate the opportunity. Definitely, people can reach out to me on either Instagram or TikTok, and you can email me at drsadaf@drsadaf.com. You can watch my TEDx, you can come to my retreat, any of those things. I'd love to meet you and get to know you.
All right. Thank you.
Thank you.
Until the next episode.